Hello everybody. In this video, we'll learn about the examination of iris. So what are the things that you have to look during examining the iris and how will you present it? So the three components that you're looking for in when you're examining the iris, the color, the pattern and the abnormalities. So coming to the color of the iris, you'll comment about it whether it's light colored or dark colored. And so if it's dark colored, and usually in Indians dark colored, you will comment as brown colored iris and stop at that. Okay. Sometimes you can see heterochromia. What is heterochromia? Difference in the color. It can either be difference in color of the iris from one eye to the other, where one eye is light colored and the other one is dark colored. This is called as heterochromia iris, where one iris is different color from the other eye. Where do you see it? You see it in congenital heterochromia, Horner's syndrome, Sturge-Weber syndrome, or Fuchs heterochromic iridocyclitis. Sometimes within the same eye, you will see that some sector of the iris is of a different color compared to the rest of it. This is called as heterochromia iridum. Okay, causes are herpes zoster, nevus, iris nevus, trauma, and glaucoma. What is the pattern? Okay, we'll ignore this. Normal pattern of the iris is it has no crypts and furrows. So you have a central sphincter, pupillae, and surrounding it, the mid-peripheral iris, you'll see crypts and furrow. This is the normal pattern of the iris. But you might see sometimes, you might see that there is a lot of fibrous exudates over it, or you see it is waterlogged, it is muddy, you're not seeing the crypts and the furrows. This is seen in case of anterior uveitis. Sometimes you'll see that the iris is atrophic. You're not seeing the color, you're not seeing the brownish pigmentation, you're seeing an atrophic iris atrophic patches you see in chronic uveitis, herpes zoster, or trauma. The abnormalities. What are the abnormalities that you see in iris? Sometimes we can see nodules around the iris, which can be seen at the margin. You can see nodules at the margin, or you can see nodules at the away from the margin. So how will you remember it as? You remember it as Coppé's nodules are at the pupillary margin, or Kinara, K for Kinara. So it is at the pupillary margin. Basaka's nodules are away from the pupillary margin. You usually see them in granulomatous uveitis. Normally, on the iris, you will not see any blood vessels. Blood vessels are within the stroma of the iris, which are not visible. But if you see blood vessels on the surface of the iris, it is abnormal. It is called as neovascularization of the iris, which is usually seen in diabetic retinopathy, CRVO, central retinal vein occlusion, branch retinal vein occlusion, or ocular ischemic syndrome. You might also see most often, I mean, normally the iris is not adherent to the lens which is behind it. But sometimes you might see iris being adherent to to the lens capsule, which are called as posterior synechiae. When you see posterior synechiae, you'll comment about posterior synechiae being present and for how many clock hours they are there and whether they're contiguous or non-contiguous. Okay, again, posterior synechiae are seen in case of uveitis. The next thing is iridodonosis. What is this iridodonosis? Iridodonosis is nothing but tremulousness of the iris. Okay, which you see in zonular descent or subluxation of iris or aphakia. If you keep observing here, you see that the when iris has a kind of a tremble to it. Okay, it keeps shaking. So that is called as iridodonosis. Now, what is this? If the iris is detached from its root, it is called as iridodialysis, right? So, in summary, uh, you are going to comment about the color. The iris has normal color or brown colored or light colored, whatever is the color with normal pattern. And you'll only comment of the abnormalities if they are present. Otherwise, you'll just say iris is normal in color and pattern and move on to the next examination. Thank you very much.